All right. Good evening, everyone. Thank you for tuning in. And if you're not here today, of course, this is available on our YouTube channel. So I want to welcome.
I think Jason is frozen.
Yeah, I wasn't sure if it was me or him.
Just bear with us one moment. So you know what? I'll do a quick intro here, Vanessa, and then I'll pass it over to you.
Sounds good.
So welcome everybody. Tonight we're going to talk about understanding hormonal health. And oh, Jason's back.
Sorry.
Here. No, that's okay. I think you cut out. I was just going to do your part. Go right ahead, Jason.
So Vanessa is a naturopathic medical student based in Toronto, completed her psychology degree at Western University. Her personal journey as a scleroderma patient is the driving force behind her passion for holistic healthcare. Along with her role as the chair of patient support on the board of directors for Scleroderma Canada, Vanessa also works in research with SPIN, focusing on projects aimed at enhancing the lives of scleroderma patients. She's dedicated to continuing patient-centered work, particularly in autoimmunity and women's health. Vanessa's holistic approach to healthcare reflects her commitment to making a lasting impact on individuals dealing with scleroderma by integrating personal experience, academic knowledge, and research expertise. So with that, I will throw it over to Vanessa to launch into tonight's webinar, Understanding Hormonal Health and Scleroderma Care.
Cool. Thank you, Jason. I'm just gonna, I think it says the host can only share, so I might need sharing abilities. There we go. Beautiful. Just going to my screen here. Can everyone see this okay? And then I believe I should, be able to hide. Can you see this okay, Mary Ellen?
Sure.
Yep. Okay.
You can see it. We can still see the essay. I don't know if you're able to.
Yeah, I don't think I can for whatever reason.
That's okay.
Okay. Hopefully I'll try and move it around if worse comes worse and it's blocking something. So thank you for joining today. This is obviously in our series on integrative approaches to managing scleroderma and looking at more naturopathic approaches to health. And today is going to be on understanding hormonal health in scleroderma. A couple of disclosures before we get started. I do have affiliations with the Lady Davis Institute of Medical Research, as I am a SPIN researcher with them. I'm on the board for Scleroderma Canada. I attend school at the Canadian College of Naturopathic Medicine. And then obviously this is brought to you by Scleroderma Atlantic. And a disclaimer that this is not medical advice. So just that this is obviously intended for self-education. If you have any questions or are interested in supplementing or taking up any of these things that we talk about today, please always talk to your medical doctor or your naturopathic doctor or both. And knowing that these are not meant for the diagnostic reasons or treatments X, Y, and Z. So hello again. I always say I obviously have come here and been through this journey because I was first diagnosed with scleroderma, and that kind of led me down a big path of wanting to come to, what am I trying to say? Wanting to eventually share my passion with everyone else about naturopathic medicine and how it can have a really big impact for people living with scleroderma. For our webinar breakdown, we only have one more after this, and that's kind of wrapping up everything that we've talked about. So we started with introduction to naturopathic medicine, going into diets, gut health, managing pain and fatigue. And then now we are at hormonal healthcare. And so May will just kind of be our last one of looking at long-term strategies and a recap of everything we've kind of gone through these last few months. And it is always the last Monday of every month, 6 p.m. EST and 7 p.m. AST. So getting into the bulk of everything, hormones, why are they important in the context of scleroderma? So changes in hormone levels and how hormones send signals to the body have been linked to how scleroderma disease severity and also how it progresses. So the chances of developing different complications. And hormones are essentially chemical messengers that control growth, metabolism, reproduction, immune responses, as well as mood. Key hormones for women's health that we are going to be talking about today are estrogen, progesterone, cortisol, thyroid hormones. We'll talk a little bit about insulin as well. And hormone health essentially means that these systems are balanced, adapting to different life stages and milestones, such as puberty, pregnancy, menopause, as well as stress. So the role of hormones in the human body, kind of touched on them a little bit, but growth, metabolism, reproduction, mood, maintaining homeostasis, so just having that internal balance in the body, and then also temperature regulation. And as I mentioned, hormones are essentially chemical messengers that send us signals to the human body that regulate and coordinate a wide range of physiological processes. So it's not just one thing. I think a lot of times when we think of hormones, we think of like estrogen, testosterone, things that are sex related, but they're not necessarily always that. They control such a wide variety of things in the body. And I think, when we talk about hormones, this could be like a 7-day lecture on the different types of hormones and their impact on the body. So it's a very loaded topic, but I think it's really important to talk about too, and have like a general understanding of what that means for ourselves so that we can educate ourselves, especially when we are going through those milestones or we feel like something might be dysregulated in the body. So endocrine connections to scleroderma. What we are going to kind of talk a little bit about today is pregnancy and scleroderma, higher incidence in women and why that might be, thyroid dysfunction, cortisol, and adrenals. I know cortisol is like the biggest buzzword ever right now. So kind of just going through what that actually is and what it means to have, actual high cortisol and how we manage cortisol imbalances. And then the metabolic changes that come with endocrine connections to scleroderma. So the endocrine connections in scleroderma refer to the ways in which the body's hormone-producing glands and hormones may interact with or influence the development of scleroderma. And then just talking about general naturopathic treatment goals related to hormonal health. So from a naturopathic doctor's standpoint, our goal is to normalize hormonal imbalances, if there are any, or even subclinical ones, how we can actually kind of normalize that, integrate sustainable habits for hormone health, support reproductive health, optimize metabolism and weight management if that's an issue for our patient, address stress, and then regulate the menstrual cycle / menopausal transitions. Again, just kind of those milestones that we might be looking at with a certain patient. And then key concepts that we are going to talk about is estrogen signaling. What is a hormonal imbalance? So again, too, I think with cortisol, we often hear, balance your hormones. What does it mean to balance your hormones? I did this to balance my hormones. And what does that actually look like, especially from an objective standpoint? And when we're looking at blood work, what does that mean from a clinician standpoint? And then how can we actually, work to have our hormones in harmony, I think is a really big topic and something we're going to talk about today. And then really briefly talking about pregnancy, menses, menopause, and then also the thyroid's role in hormonal health, because I always think the thyroid is like, 50% of what we're going to talk about when it comes to hormones. It plays such a massive role when it comes to hormonal health. And then key takeaways for today: deciphering hormonal concerns, understanding optimal patterns in hormonal health. I want to have a couple of easy to implement strategies to support hormonal regulation, and then general naturopathic approaches to hormonal healthcare. So some of the different botanicals, supplements, recommendations that naturopaths generally give when we might be faced with some kind of hormonal imbalance, whether that's a condition or if it's just general imbalance that we see in patients. So going into estrogen signaling. So estrogen signaling refers to the biological process that the hormone estrogen exerts its effects on cells and different tissues through binding to something called an estrogen receptor. So we think of estrogen kind of binding to that receptor. And this signaling plays a very critical role in many different physiological processes, including sexual development, reproductive function, bone health, cardiovascular health, and brain function. So it has a wide range of different physiological processes. Dysregulated estrogen signaling is often implicated in diseases such as breast cancer, endometrial cancer, osteoporosis as well, which is when we have low bone mineral density and kind of like brittle bones is what a lot of people talk when they say osteoporosis. And then also cardiovascular disease. So estrogen signaling has been implicated in scleroderma, particularly with how it contributes to fibrosis and immune dysregulation, and also the female predominance of the disease. One of the first things when I was thinking of topics related to scleroderma and naturopathic medicine, I was like, well, we know that scleroderma affects mostly women. So there has to be some kind of genetic tie here. There has to be some kind of influence from our hormones, and kind of digging deeper into what that means. So scleroderma obviously affects mostly women, sometimes during reproductive, but then also into the menopausal years. Estrogen is thought, it's not 100% sure, there's still some emerging research that's a contributing factor due to its influence on the immune system, and then also fibroblasts, which might be responsible for that underlying fibrosis, which is what we see in the literature. So estrogen can promote fibrosis. Estrogen signaling can activate fibroblasts and then increase the production of collagen and extracellular matrix, which we know scleroderma to be a fibrotic disease. So we have a lot of that excess collagen in the body, which may potentially be a result of different estrogenic pathways. Not saying that's 100% of the story, but it could potentially have an effect with it. We also see that it may have an effect with immune modulation, and then estrogen receptors in specific scleroderma tissues. So we kind of see an overexpression of these different estrogen receptors in some of the pathways that are upregulated in scleroderma skin biopsy. So when we actually take a person living with scleroderma at their skin and then seeing this upregulation of some of those estrogen receptors. So knowing that it definitely has this kind of tie to it. Clinical evidence is obviously a little bit limited, and especially hormone manipulation is something that can be, we want to do very cautiously. Even when it comes to, something as, I don't want to say simple because it's not a simple disease, but something more like clear cut, like PCOS. We know what's going on there, and we know very well with evidence how to treat it. We always want to be a little bit careful when we're kind of modulating different hormones and what that kind of looks like, especially for people. So yeah, going on to the next one, and I just have this really quick one. This is not like a super scientific graphic at all too, but just kind of, the wide range of what we see for when we're talking about the effects of estrogen on the body. Same goes for testosterone for men. We have a very wide range of what that looks like in the body as well too. Then going on to our hormonal imbalances, this is going to be a little bit of a lengthier slide. So just kind of going over what these actually are. I know a lot of us hear testosterone, estradiol, estrogen, progesterone, all of these things, but what do they actually mean? So when we are talking about testosterone, and when we are getting these tested too, so if you are currently menstruating as a woman, we want to test these at certain days. And I think this is sometimes a part too. I know with different patients that we see that gets missed, or the communication of this sometimes is poor when someone is given blood work. They may or may not be told to do it on a certain day. So if you're menstruating, there are certain days. If you are currently stable in menopause, you don't have to worry about this. If hormones are completely stable, the ranges aren't going to change very much. However, they will change pre-menopause. And then if you're in that transition period between, potentially being menopausal, we're in that transition, then these may be out of range. However, it doesn't mean that they're abnormal. So it just depends kind of where you are in your cycle and what milestone you're currently at. When we are talking about testosterone, if you are premenopausal, the best time to test is generally day 2 to day 5, along with other androgens, but in particularly for PCOS. It's less cycle dependent than estrogen or progesterone. However, early follicular phase gives us a better reading of testosterone. When we are testing for progesterone, the best time to test is day 21 of a 28-day cycle. So if we look at, menstruation is the beginning of our cycle, and then towards the end, it's going to be towards the end of it, in your mid-luteal phase. And this indicates if ovulation occurred, and if luteal function is normal. So especially for people living with PCOS, which is polycystic ovarian syndrome, we want to know if someone has ovulated. That's a really important indicator, if they're having correct functioning when it comes to a menstrual cycle, especially too, even for menopause as well. We want to see if the person is still ovulating or not. For estradiol, which is a type of estrogen, the best day to test is day 2 to 5. Generally, I want to say rule of thumb is usually day 2 to 5, or mid-cycle to check ovulation status. And that's because levels change throughout the cycle. For LH, the best time to test is day 2 to 5 as well. Mid-cycle, sometimes we do day 12 to 24 to detect ovulation. And this is because LH, which is luteinizing hormone, we have that big change significantly throughout the cycle as well too. For FSH, which is follicle stimulating hormone, the best time to test is day 2 to 5 of the menstrual cycle, early follicular phase, as we mentioned before. And this helps us as ovarian reserve and pituitary function, and levels generally vary across cycle too. This is also quite an important one, especially when we're talking in the context of menopause. If we have a higher FSH, that means that our body is trying to essentially promote that follicle to happen. We want the body to become pregnant. It's trying really, really hard. So FSH is high. It's trying very, very hard, to produce that follicle. However, if our ovarian reserve is declining, especially in menopause, then that means that it's having to work extra hard to do that. Essentially, for AMH is anytime in the cycle. It's not cycle dependent. It reflects ovarian reserve, so you may also have this tested potentially in menopause too, or if there are any concerns with fertility. And then cortisol, I have a little star here because this is not cycle dependent, but timing does matter. The best time to test is usually in the morning, 8 to 9 a.m. We always do AM cortisol, as it follows like a different rhythm throughout the day. We get a very big peak in the morning and then it drops throughout the day. I always say with cortisol too, this is like a massive trend right now. People love to talk about cortisol all over the place. However, cortisol, when we are talking in the context of high cortisol versus low cortisol, there are only 2 cases in which we actually would have high cortisol. So, I see it all the time. I did this to reduce my cortisol. I did this. Well, if we actually had clinically high cortisol, we would be in a really sticky issue. Like that's a medical emergency if we actually have clinically high cortisol. So clinically high cortisol is something called Cushing's or Addison's disease. Like I said, they're medical emergencies. To actually have clinically high cortisol is a really big thing. I think what the trend is that we are seeing online is high cortisol is often just a synonym now used for high stress. So generally people will say, I did this to decrease my cortisol. I started drinking more water in the morning and now I don't have cortisol face is also a thing too. But generally when we are carrying a lot more stress, we do have, maybe not an optimal pattern of that cortisol. Doesn't mean cortisol itself is high if we actually do a reading of it. No. However, it just might mean that diurnal path of it might look a tiny bit different. And generally cortisol testing, sometimes naturopaths do it, sometimes they don't. It just depends on the person. So sometimes we'll do a salivary cortisol testing of it throughout the day to see if we can detect any of those hormonal imbalances. But if we were to actually do a clinical reading of it, we wouldn't necessarily see it as high. Does that mean that cortisol, again, like I said, doesn't follow that pathway necessarily optimally? It could potentially. I usually find personally, this is completely personal, but as I would treat this, if someone comes in and we're suspecting, maybe their cortisol is slightly imbalanced, this is generally, the treatment for it doesn't change. We want to treat them as if they're under chronic stress. They may be having a more stressful period in their life, and how can we actually kind of treat that? Just trying to make sure I'm not missing anything here. Yes. Okay, beautiful. So going on to pregnancy and menses. So when we are talking about cycle regularity, that was a big one that I want to talk about. So hormone cycles may potentially become irregular, especially with scleroderma, due to chronic inflammation, stress, weight loss. Malnutrition is also a really big one that they may lose their cycle with. And then medications potentially affecting the ovaries. So there's a couple of different ones, but unless your doctor has mentioned this to you, it's usually not too much of a problem. Estrogen plays an immune modulation role. Lowering the levels may potentially affect autoimmunity. So if we have an irregular cycle, that is definitely something we want to take seriously. If it's irregular, especially due to GI problems, that's something that we can always fix with potentially with diet changes or interventions, or even with different feeding tubes, etc., to actually make sure that the person is nourished enough so that they are getting their menstrual cycle. Estrogen, plays an immune modulation roles, generally just affecting the way our body responds. Pregnancy in terms of a hormonal milestone. So pregnancy is a massive shift when it comes to hormones. Progesterone, oh my gosh, I cannot speak today. Progesterone, estrogen, and cortisol and prolactin all increase absolutely dramatically. And in stable scleroderma, we do see the literature is somewhat mixed. However, what I've seen is that pregnancy is generally well tolerated. I do know that we obviously have major concerns when people with scleroderma do get pregnant. You know, it's a higher risk pregnancy, sometimes lower birth rates with pregnancies. We also do get slightly concerned if there's any skin fibrosis, especially over the stomach region. And then also for people with diffuse scleroderma, that's something that we want to be careful about. However, not something that cannot be managed always with a rheumatologist. Usually we are always just keeping a closer eye on these patients as well too. We do know that hormonal changes can exacerbate or improve symptoms, especially with stress, cardiovascular, and renal systems. Autoantibodies may potentially cross into the placenta as well, increasing the risk of neonatal lupus or congenital heart block. However, these are extremely rare too. They're just cautions. So just knowing, I feel like this is obviously quite intuitive that there are those massive hormonal shifts in pregnancy, and working very closely with your doctor or rheumatologist specialist that you may see, since we do have those big hormonal shifts. We talked a little bit about this, but menopause is obviously the mark of estrogen decline. So menopause leads to decreased estrogen. And in particular for patients living with scleroderma, this could mean increased joint pain. We see this even in people without scleroderma, dry skin, fatigue, and mood swings, potentially the worsening of Raynaud's phenomenon, and then also an increased osteoporotic risk, especially with steroid use or malabsorption. The big one that I want to highlight here is that osteoporosis risk. This is something that we can definitely combat too, with vitamin D supplementation, calcium supplementation. Another one is also, which I say to people too, even when you're young, lifting weights is the best way, or doing some kind of stress invoking exercise that is going to help our bone mineral density. Jump training is also fabulous too. You know, usually you can YouTube different videos of what jump training means or jump progressions. Skipping rope can be fabulous too. We want to put pressure on our joints in order to make them stronger. And I think that it's always something that we can start earlier rather than later, and build up that bone mineral density. So when we hit menopause, or maybe we are menopausal, it's something that we can integrate very easily. It's not something that you need to work through with your doctor and naturopath. You know, lifting weights and doing resistance training is one of those really important things that we can add into our life, and it's very easy to incorporate. I'm definitely a sports medicine person, so I'm always like, everyone should be lifting weights, everyone should be doing stress invoked activities, if possible. Obviously modifications for people living with scleroderma, we have fatigue, we have you know, different fibrosis, we have different disability factors too. So what that means to each and every person is different, and that might be tailored to every different person differently too. But if possible, then, you know, that's something that we want to consider. Hormone replacement therapy is something that is widely available now. I feel like it's become a lot less controversial too within recent years, but this can generally help symptoms. But it must be balanced with cardiovascular risk. So people living with scleroderma, it can sometimes affect the heart and the vessels. However, again, too, that's always usually determined by your medical doctor. If you're at high enough risk, they may not be responsive to wanting to prescribe that to you. However, again, too, if it's not as risky, it may be something that could be an option. And then just always talking about, there's kind of this cycle, I want to say, between hormonal imbalances and autoimmunity. So chronic inflammation from scleroderma may disrupt, you know, the hormonal axis, the HPA axis. It's called the hypothalamic pituitary axis in the body, altering hormone levels. And then hormone changes, for example, in estrogen decline that we are getting with menopause, may increase inflammatory cytokines, worsening symptoms essentially. And then stress hormones, cortisol, as if these are elevated, they may be or suppressed in chronic disease. This may affect metabolism, energy, and immune response. So there's all these things kind of going at play, especially when we hit these different milestones. Again, I feel like moral of the story, working with your doctor, working with a naturopath, who can kind of go over these different shifts with you is something that can be really beneficial. So then going into the thyroid, again, this might be a more lengthy slide as well too, but the thyroid gland plays a very critical role. It is this little like butterfly or bow looking structure that sits on top of the trachea here, plays a very critical role in hormonal health by producing hormones and regulating metabolism, energy levels, body temperature, and mood. As I mentioned, it's located on the front of the neck, and it produces primarily thyroxine, which is T4, and then I don't even want to try to pronounce T3, but T4 and T3 are the two different thyroid hormones that are produced, which influence, I want to say, almost every cell in the body. It has a massive influence in the body. So the key functions, as we mentioned, metabolic regulation, they increase our basal metabolic rate, meaning that they control how fast or how slow our body burns energy. And you can obviously imagine what this can mean for different thyroid disorders, either speeding up metabolism or really slowing it down, influencing heart rate, body temperature, and then also oxygen consumption. In growth and development in children, thyroid hormones are essential for our brain development and physical growth. And then deficiencies in pregnancy or early life can sometimes lead to developmental delays or congenital hypothyroidism. Mood and mental health. Low thyroid function is linked to symptoms like depression, fatigue, cognitive sluggishness, and then high thyroid function causes a lot of anxiety, irritability, restlessness, and then reproductive health too. If there are any imbalances in the thyroid, we may potentially see irregular menstrual cycles, fertility problems, and complications in pregnancy. So common thyroid disorders are hypothyroidism, hyperthyroidism, having a goiter, and then thyroid nodules or cancer. And the reason that we kind of talk about thyroid is we see sometimes that there is an overlap between people living with scleroderma and thyroid conditions. Generally, I believe the evidence is more around hypothyroidism or thyroid antibodies for people living with scleroderma, but potentially can be something that we may want to screen for. Usually in our blood work that we get done with our doctors, they are always screening for TSH, T4, and T3. At least TSH is usually done. I want to say at the bare minimum. So when we're talking about hypothyroidism, this is an underactive thyroid. Common causes meaning Hashimoto's thyroiditis, which is an autoimmune process, and kind of where we might see that overlap for people living with scleroderma, or an iodine deficiency, which is usually quite rare. However, it does still happen. Hyperthyroidism is an overactive thyroid, often caused by Graves' disease. A goiter is an enlargement of the thyroid. We often see this sometimes in hypo, sometimes hyper, usually not hyper, but hypo. Thyroidism and autoimmune diseases, and then thyroid nodules or cancer are abnormal growths in the thyroid gland. To go off of this too, I just want to double check my last slide. Yeah. The hypothalamus essentially releases something called TRH. The pituitary gland releases TSH, which is our thyroid stimulating hormone, and then thyroid gland produces T3 and T4. Blood tests are usually, as I mentioned, they'll do TSH, T3, and T4. And then, as I mentioned, thyroid disorders are relatively common for people living with scleroderma, particularly the autoimmune form. When we are talking about autoimmune thyroiditis, this is the most common thyroid disorder in scleroderma patient. It leads to hypothyroidism, which is that underactive thyroid, and it is immune-mediated destruction of the thyroid gland. So when we think immune-mediated, it's autoimmune, the body's kind of attacking the thyroid itself. It may present with fatigue, weight gain, cold intolerance, and depression. Sometimes it can be very difficult to screen for hypothyroidism because already, we have that cold intolerance with Raynaud's. We potentially may have fatigue or depression already with scleroderma. So sometimes it can be hard to tease out, which is usually why they test for it anyways. But I always say, if we're having weight gain, fatigue, cold intolerance, depression, etc., Dry skin is also a really big one too, and then hair loss. It's always a good thing just to test for. It's a super easy blood test that we can rule out. Usually presents with elevated TSH and low T4, and then positive thyroid antibodies, sometimes in the case for Graves' disease or hyperthyroidism. This is less common, but it is still seen with people living with scleroderma. This leads to an overactive thyroid. Symptoms include weight loss, heat intolerance, anxiety, tremors, and palpitations. So quite literally the exact opposite of hypothyroidism. And it's associated with TSH receptor antibodies. In terms of blood work as well too, for hyperthyroidism, we generally have a low TSH, a high T4/T3, and then often positive antibodies as well too. Sometimes we can have subclinical hypo. I know people are probably like hypo is the one where we have that weight gain, people are cold, etc. But for subclinical hypothyroidism, we will still sometimes see that elevated TSH, normal T4, normal T3, and possibly antibodies. So I can actually add kind of a personal touch to this too. I don't even know why, I think it was just my general blood work that I was getting done for scleroderma. And my TSH was super high, I believe it was. Yeah, it was quite high. And I was like, oh, that's really weird. So then they tested my T3 and T4. T4 was slightly low, I believe it was. Yeah, slightly low, and then T3 was normal. And then I asked my doctor to do the antibodies as well too, because it was something that I was curious about. Antibodies absolutely off the chart. So does this necessarily mean that I have hypothyroidism? In this case, no. It doesn't necessarily mean that anything is wrong. However, from a naturopathic perspective too, we might want to keep an eye on this. This might be something subclinical. Does it mean it's going to progress to full-blown hypo or hyperthyroidism? No. But it is something that we may want to take a look at and how we can manage it, especially, for me, I wanted to know how I could manage it myself as well too. In terms of tumor markers, we might be looking at thyroglobin, and then calcitonin are also the other markers that we might look for someone with a thyroid dysfunction. And then general symptoms of hormonal imbalances too. Like I said, this can kind of mean a lot of different things. So it could be those, any of the hormones that we talked about, if any of those are kind of out of whack, if it could be the thyroid, something concerning our thyroid. We might see mental health symptoms, digestive issues, menstrual irregularities, weight change, and then hair and skin changes. So it really is a whole host of patterns. I also say too, a lot of times, when we can kind of tell something hormonally is off, we might be experiencing changes in our cycle. We might be experiencing that irritability that you might think of breaking out, especially along the jaw, are big things that we often see for people with hormonal imbalances. So different naturopathic approaches to managing different conditions. This is kind of condition specific, but we are going to talk about generalized as well too. So for PCOS, we are looking at something called myo-inositol. This is a supplement. It's kind of like a sugar derivative, but it helps to sensitize the body to insulin. So we're taking up insulin a lot better too. Spearmint tea, because it lowers androgens, omega-3s. We talk about a low glycemic index diet. So a lot of whole foods, lots of leafy veggies, fruit, etc. Something to keep the glycemic index quite low. We're reducing those starches, white bread, white pasta, which I know is fabulous. Obviously, I say pair it with protein, still have it in your diet. Don't fully cut it out if it's something you love. Optimizing protein as well too. We always talk about this when it comes to diet. Weight loss, vitamin D, and then also stress support are kind of first line for when we're looking at PCOS, especially from a naturopathic standpoint. PCOS too, I know first line from a medical standpoint is usually birth control, and that's usually to reduce the risk of endometrial cancer. We want the person to be having their menstrual cycle and actually bleeding if they're not in the menopausal period. So we're reducing that risk. Nonetheless, there's not, we have much more evidence for birth control. However, some of these interventions can be very effective as well too. When we talk about insulin resistance, so this is similar to PCOS too. It happens if people are chronically stressed. Sometimes we can see it in autoimmune diseases too, if the body is chronically stressed as well. These people usually present with a lot of weight gain, specifically around the abdomen. So we call it central adiposity. Around the abdomen, they're having a harder time losing weight, very fatigued, very tired. Potentially depression as well too can be a symptom of insulin resistance. Sometimes you can do markers for this. Sometimes we might not, and we may just suspect that someone has insulin resistance. Diet and exercise, I always say, are the first line treatments for this. But then we can also talk about digestive bitters, potentially apple cider vinegar. I know a lot of people usually dilute about a tablespoon in a decent amount of water in the morning to stimulate digestion if this is an issue. Exercise, inositol, a magnesium-rich diet or magnesium-rich supplementation, cinnamon, berberine, alpha-oleic acid, which is this ALA, is also something too. So we talk about a balanced diet is kind of the cornerstone, the focus of whole foods to stabilize blood sugar levels, reduce inflammation, and support balance. When we talk about different supplements too, or nutritional interventions, cinnamon is one that we can use. It can be used to lower blood pressure, improve insulin sensitivity by enhancing the body's effectiveness of insulin in the body. So adding ground cinnamon to smoothies, oatmeals, or teas. Sometimes this is something that I'll do if I have a tea, I'll just add in extra cinnamon. If it's appropriate to add cinnamon to it, I'll usually try and do that as well too. Berberine is something that I think people have caught wind of as well. It's a powerful compound found in several plants, and it's been shown to significantly improve insulin sensitivity and regulate blood sugar. So then going into a couple of different other hormonal imbalances when it comes to estrogen dominance, which this is something, it's a very common hormonal imbalance. I want to say a lot of women will experience this at some point in their life, especially for women of reproductive age or during perimenopause. So this occurs when estrogen levels are too high relative to progesterone. Also, sorry, my cat is doing something crazy. Kirby, come here. So when estrogen is just a bit too high relative to progesterone. So this may not actually show on our blood work that any of these are out of order. However, from a naturopathic perspective, if we're looking at that kind of ratio from estrogen to progesterone, and it seems a little bit out of the range, even if estrogen is in normal range, this can potentially still lead to a range of different physical, emotional, and reproductive symptoms. So we're thinking a lot of kind of those exacerbated PMS symptoms. So breast tenderness, acne, especially along the jawline, or hormonal acne, heavy periods, worsened PMS, etc. And how we would manage this is we're looking at dietary changes, so increasing fiber intake to support estrogen elimination via the bowel. So I always say for people, generally adding ground flax is a fantastic way. It's adding more fiber into the diet if our body is able to handle it, whole grains, vegetables, but usually 2 tablespoons of ground flax, sometimes 3 if we can tolerate it, again too, is a fabulous way that we can increase that fiber intake very easily, but also support our elimination of estrogen from the body. Cruciferous vegetables, so our broccoli, cauliflower, kale, Brussels sprouts, all contain DIM, which is something that helps to support estrogen metabolism. Avoiding xenoestrogens, so these are synthetic estrogens in plastics, pesticides, non-organic meat or dairy. Depending on how strict we want to be, I'm usually not too horribly strict on these with patients, but if it's something that we definitely see with someone who is just having this really stubborn estrogen dominance, that may be something we want to consider. And then reducing our sugar and refined carbs. We may also want to do liver support. So some different supplements that we talk about are milk thistle, dandelion root, turmeric, NAC, B vitamins, especially B6, B12, and folate. In terms of gut health, potentially optimizing if we see a dysbiosis in the gut, probiotics, fermented foods. We talked about this as well too in our gut health lecture as well. And then for different herbs, potentially chash tree, which is known as Vitex, is one of the most, I want to say one of our most like powerful herbs that we can use to support progesterone production and balance the menstrual cycle. Dim, as I mentioned, is something that we find in cruciferous vegetables and helps promote healthy estrogen metabolism. And then rhodiola or ashwagandha, if we think that adrenal stress might be an issue with our current patient. Different lifestyle factors, as I mentioned, exercising regularly, stress management, and then also sleep, aiming for that 7 to 9 hours of good quality sleep. And we can always do lab testing too for estradiol, progesterone, estrone, estrol, cortisol, and DHEA if we think that estrogen dominance is worth, really doing a good investigation, especially if we think something like PCOS may be underlying it too. In terms of general cortisol imbalance, we always want to look at diet, lifestyle. I want to say lifestyle is like the biggest component when we're talking about cortisol imbalance, getting people to sleep again, but then also different herbs like our ashwagandha, lemon balm, all of these different things, chamomile, that we can add into the individual's routine to kind of help them with that cortisol imbalance as well too. In terms of trying to think how much time we have left here. I could talk for like 100 years. For thyroid related disorder, so it really just depends which thyroid disorder, but for hypothyroidism, we might want to look at iodine supplementation, selenium, zinc, iron, magnesium, vitamin D, and B vitamins, and then also focusing on an anti-inflammatory diet. Again, too, we might also look at something like ashwagandha, which is an adaptogen, like a botanical medicine that can support our thyroid hormone production and reduce cortisol, so reducing the stress in the body too. And that kind of helps us, get out of that hypothyroid state and re-normalize things in the body. For hyperthyroidism, for diet and lifestyle, we're kind of looking at an anti-inflammatory whole foods diet, avoiding iodine supplementation because it can aggravate symptoms. So again, like I said, hypo and hyper are the exact opposite of each other. And then caffeine and stimulants should be avoided. For different botanicals, we may consider something like a lemon balm, a mother's wort, L-carnitine, and then doing nutrient considerations like magnesium, B vitamins, vitamin C, and calcium to help support the nervous system. And then, as always, I usually say a whole foods diet, key nutrients, a magnesium, vitamin-rich diet is always beneficial for just about every disorder out there. And I believe that was it in terms of thyroid related disorders. Yes, yeah. Okay, I think that was it. Yeah. Thank you so much. I think this is questions period. If anyone has any questions as well too, I'll stop sharing my screen here.
That's awesome. If there are any questions, Q&A function at the bottom of the screen. Give it a minute or two. Lots of good information as always, Vanessa. Thank you.
Thank you.
I'm still trying to figure out the one thing that stood out was like 7 to 9 hours of quality sleep. Yeah. How do you do that?
I know. Adaptogens. That's usually my first recommendation. I know, me too. But I also say this is can sometimes be iffy for people living with scleroderma because we don't want it too cold. But if you can like decrease the temperature in your room, can be very beneficial because we want our body to actually get into that. Yeah, that restorative spot. But tough, I know. Coming out of a stressful period is always the hardest time to sleep as well. It's like when you need it the most, you get it the least.
That's right. Okay, I don't see any questions. So again, thank you, Vanessa, for all your wonderful wisdom, sharing with us. Just so everyone will know, of course, this will be up on our YouTube page. And we will be back next month, April 26th May 26th. Hard to believe it's May.
Jason, there is one question there.
Oh, sorry, I didn't see that.
Yeah. Let me know if you can see it.
Yes.
I can't. So can you read it?
I can. It says, I have polycystic ovarian syndrome and I don't hear it spoken about very often.
Yeah.
Did you mention it because it's particularly connected to scleroderma or just because it's a hormone disorder? Also, part 2, you mentioned stress support can help. Do you mean herbal stress support? And also, what does subclinical hyperthyroidism mean? Not sure about subclinical.
Yes, yeah. Okay, good questions, Heidi. You always have very good questions. I feel like, um, yeah, thank you for sharing that you have PCOS too. I unfortunately also see as well. It's not talked about very often, especially in mainstream stuff, but it's a very common disorder. So it surprises me every time. I'm like, oh yeah, someone's, doctor didn't necessarily educate them, or they didn't hear about the proper support that they need for it too, because it's a very treatable condition. Sorry, I'm just pulling up your question as well too. Not necessarily connected to scleroderma. The research is limited in terms of connections there. So I don't want to say that it's necessarily something. It's more just because it's a hormonal disorder, and a very common one at that we talk about it too. And then you said something for stress support. Yeah, so this could be from an herbal standpoint that we treat it with botanicals. I want to say more lifestyle. So as Jason and I were saying, the 7 to 9 hours of sleep, decreasing stress, whether that's through meditation, yoga, kind of integrating different stress support things in our life. And then if that's not doable lifestyle wise, then that's when we would kind of want to go into botanical support too as well. Maybe having chamomile tea at night to help us rest, or what that potentially means to you as well. And then subclinical essentially just means that on our blood work, it may not be the optimal level. So, when you get your blood work back and they have this specific range, it may just be just under the range. Or for instance, for subclinical hypothyroidism is we would see TSH is elevated, but then T3 and T4 are usually normal. So that just means that, TSH, our thyroid stimulating hormone, is working really hard. Like we're trying to produce a lot, but something's not coming out of it. It's not functioning optimally. So does it mean that we're full blown having hypothyroidism? No, but we may still see some of those symptoms for people who are experiencing more of a subclinical picture. So I always say it's just kind of like, it's not the full blown disorder. Does it mean it may progress to the disorder? Maybe. But it just, we're still in that kind of period where it's maybe getting there, and you may still be experiencing some of those symptoms. Does that answer your question okay? Yes, yeah, notes. Yes, I should be able to share my notes. I'll have to clean them up for you, I will say, but I can definitely share notes for sure. They're definitely super ugly, but I'll do a little work on them this week and then share them to you.
Excellent. Thanks, Heidi. Great questions. All right, so I think we'll wrap it up there. So again, thank you, Vanessa. We will see you in May for our wrap-up session. So looking forward to that as well. So wishing everybody a good evening, and we'll see you all next month.
Sounds good. Take care.
Have a good night. Thank you, everyone.
Bye.
Bye-bye.